since the BC NDP government begged this Prime Minister to reverse his decision that made it legal to shoot up heroin on public transit and to smoke meth and blow it into the faces of nurses in hospitals. On what date will the Liberals make that illegal again in British Columbia?
Good question.
The Honourable Minister of Mental Health and Addictions.
Mr. Speaker, the province of BC came to the federal government with a 3-year pilot program using decriminalization so that people would not die alone, that they would get health care, Mr. Speaker. The BC government has asked for an amendment to their proposal. We are working through it with them, Mr. Speaker, because we need to get it right. We want people to live, Mr. Speaker, not be criminalized. We want them to get health care. The opposition doesn't have a plan, and all they do is stand there and shamefully fundraise off the lives of people who are dying.
The Honourable Member for Stormont Dundas South Glengarry.
It has been a week. Why is this not done already? The stories in BC are horrifying. Heroin shot up in parks, on buses, and even at Tim Hortons in Maple Ridge. Nurses having meth smoke blown in their face. Parents in Abbotsford scouring sports fields before their kids' games to make sure there's no needles and syringes around. But it gets worse. The Prime Minister won't even rule out expanding this to cities like Montreal and Toronto that have asked for the same craziness. Why won't they clearly give a date and frankly just end this failed policy now in BC and never expand this anywhere else in Canada?
The Honourable Government House Leader.
Mr. Speaker, ever since the Canadian Charter of Rights and Freedoms was born 42 years ago, Canadians have had confidence that their federal government will respect their charter-guaranteed rights and freedoms. Now, the Conservative Party will not say they have promised to tear up the Charter of Rights in matters of criminal justice. Now, where will they stop? They have not ruled out extending it to reproductive rights. They have not ruled out extending it to the rights of people for a fair trial. Where will these Conservatives stop when it comes to ripping up the rights of Canadians, Mr. Speaker?
The Honourable Member for Kelowna Lake Country.
Continue to insist they don't have enough data from the BC government to end the open drug use of hard drugs like cocaine or fentanyl on streets, in playgrounds and in hospitals in British Columbia. The BC government confirmed that they sent the Liberals the data that they requested within hours of asking. But if the minister can't make a decision, how about the fact that more British Columbians sadly died of overdoses in January and February of 2024 than in all of 2014? Wow. Why are these Liberals not being honest with Canadians and just end their radical drug policy?
The Honourable Minister of Mental Health and Addictions.
Mr. Speaker, every step of the way we have been working hand in hand with provincial jurisdictions, communities and municipalities across this country, speaking to families, speaking to health teams to understand how we save lives, Mr. Speaker. We are working with the province of BC on the amendment to their proposal. We need to get it right, Mr. Speaker. We need to make sure that communities are safe, but we also need to make sure that people aren't dying alone, that they are getting the health care services that they need. You can't treat someone if they're dead, Mr. Speaker. We are committed to saving lives.
The Honourable Member for Kelowna Lake Country.
Well, Mr. Speaker, if that member thinks that BC's experience with open public drug use is so great, then why isn't she advocating for it in her province? I was talking to a resident just 2 days ago from my constituency.
Hold on a sec. We are getting a lot of yelling back and forth, and I would appreciate it if people could just keep it down. I know. I'm hearing a lot. I'm hearing a lot from all ends of the chamber. So I just want to make sure that we keep the down as we debate these important issues. The Honourable Member of Kelowna Lake Country.
Well, Mr. Speaker, if that member thinks that the BC experience with open public drug policies and drug use is so great, then why isn't she advocating for it in her own province? I was talking to a resident from my community just a couple nights ago who told me she came around the corner from her apartment to be faced with something that burnt her eyes. and people were openly using drugs on the street. She is rightfully concerned about what she is exposed to, and unfortunately this is not an isolated incident. After 9 years of this Prime Minister, enough is enough. Why are these Liberals not being honest with Canadians and just end their drug policies?
The Honourable Government House Leader.
Of course, Mr. Speaker, that question has been asked many times and answered many times by my honourable colleague, the Minister. What I want to know, this member is a female member of her caucus. This morning, the headline reads, "Conservatives don't rule out using notwithstanding clause beyond criminal justice matters."
Shameful.
50 years ago, Roe v. Wade was enacted in the U.S., and women have lived under that protection in the U.S. for 50 years. For 42 years.
Order. Order. Goes all ways. So to be able to keep it down so I can actually hear the answers, the questions, and of course the answers. The Honourable Government House Leader.
From the top.
15 seconds.
For 50 years, women in the U.S. have lived under the protection of Roe v. Wade. For 42 years in Canada, women in Canada have lived under the protection of the Canadian Charter of Rights and Freedoms. Now Conservatives will not rule out using the notwithstanding clause beyond criminal justice matters. Will that member stand in her place and tell us what rights from women does she intend to take away?
Hear, hear.
That'll get you back up to 20% of the polls, Steve.
Let's just say 50 seats in the next election.
Ready for the next question? Yes. All right. The Honourable Member for Langley Aldergrove.
After 9 years of this Liberal NDP Prime Minister, it is clear that he is not worth the crime, the chaos, the drugs, and the disorder. As a direct result of his extremist drug policies, we have open drug use in front of an elementary school in Langley, discarded needles at a playground in Willoughby, and crack smoking at a bus stop in Brookswood. People from Langley want to know, when is this Prime Minister going to end his extremist experiment to legalize hard drugs like cocaine, fentanyl, and opioids?
The Honourable Minister of Mental Health and Addictions.
Mr. Speaker, I will say this again. We have to approach the opioid crisis and the illegal toxic drug supply with compassion, science, evidence, and healthcare, Mr. Speaker. On this side of the House, we all want the same thing: public safety and access to public healthcare services so that people don't die alone. We are approaching the issue of public consumption with urgency, Mr. Speaker, working with the BC government on their requested amendments to their proposal. BC asked for this exemption. We will continue to work with them hand in hand because families are demanding it of us. They don't want to lose their loved ones, and on this side of the House, we will save lives.
The Honourable Member for Langley Aldergrove.
Well, the results are in, and they're a disaster. 2,500 opioid overdoses last year.
Order.
In British Columbia.
Order. If we need to shut things down over here, I need to shut things down over there. So try to keep the chatter down. The Honourable Member for Langley Aldergrove.
The results are in. And they are a disaster. 2,500 deaths last year, and 6 on average every day this year. Now, the Liberal minister responsible for hard drug use says, well, she's waiting for more information from BC, but the BC government says they've given her all the information, as if 2,500 drug deaths in 1 year isn't enough data to go on. So Canadians want to know, why are Liberals misleading them? And when are they going to put an end to this disastrous, failed drug use experiment?
The Honourable Government House Leader.
That question has been asked and answered. BC has been making adjustments to their pilot project, and of course, Mr. Speaker, we are supporting them. But I had no luck with the last member. Let me ask this member. Conservatives will not rule out using the notwithstanding clause.
Order. Order. As I have said before, if I need to shut the noise down in one corner of the room, I need to shut it down in the other corner of the room. So please let the Honourable Member respond so we can get on to the next question. The Honourable Government House Leader from the top. All right.
Mr. Speaker, of course, BC is making adjustments to their pilot project, and we are supporting them in that endeavour, and the member should be under no ambiguity about that. The member is ambiguous, however, like his previous colleague, about which charter protections that party would rip up Is it reproductive rights? Is it the right to a fair trial? Is it the right to free expression, Mr. Speaker? That member needs to get up, that party needs to get up, that leader needs to get up and tell Canadians exactly which fundamental charter rights they will be taking away from Canadians.
I'm trying to shut down that end. I'm trying to shut down this end. I want to be able to hear the answers to the questions and the answer, and that's enough of that. The honourable member for North Okanagan, Shuswap.
Mr. Speaker, after 9 years, this Prime Minister is clearly not worth the cost. His minister responsible for hard drugs on the streets is misleading Canadians. She said the Liberal government is waiting for more information from BC on if they should reverse their decision that allows cocaine, opioids and fentanyl in parks, playgrounds and hospitals. The BC NDP government confirmed they answered within hours to the government's request for more information. Why is this Liberal NDP government misleading Canadians, and why can't they just end their disastrous drug policy?
The Honourable Government House Leader.
Well, Mr. Speaker, that member needs to unplug from the wall, replug and reboot. He's not listening to the earlier questions. We've told them very clearly, BC has requested changes, and we are working with BC to make those changes. But maybe that member will tell us specifically which freedoms, which rights described in the 42-year-old Canadian Charter of Rights and Freedoms that Canadians cherish will he be advocating removing from Canadian women, from Canadian people? Is it the freedom of expression? Is it reproductive rights?
The honourable member for North Okanagan, Shuswap.
I'd like to remind the member that his government illegally invoked the Emergencies Act, removing civil abuse from Canadians.
Exactly what they did. Guilty of it. Broke the law.
After 9 years of radical NDP Liberal government drug policies and toxic drug deaths in BC reaching a 380% increase, the number of children aged 10 to 18 who have died from overdoses has increased by more than 5 times. Opioids and illicit drugs are now the leading cause of death of youth aged 10 to 18 in BC. Will the Prime Minister end his radical drug policies, or will he continue to show he's simply not worth the cost?
The Honourable Minister of Labour.
Speaker, there are right ways to go about things, and then there are explosive and dramatic and catastrophic ways to go about things. To talk about using the notwithstanding clause, and I quote,
I'm going to make sure the Honourable Minister has his time. The Honourable Minister of Labour.
the leader of the opposition's response that all of my proposals are constitutional and we will make them constitutional using whatever tools the Constitution allows me to use to make them constitutional. I think you know exactly what I mean, he says. They will happen and they will stay in place. For anybody like me who has a right that was afforded to him because of this charter in my lifetime, these are chilling words that they